So today we're talking about an enormous topic that we could spend hours and hours or a semester on. This is environmental health. Let me click to the next slide. Here we go. So I just want to start by sharing this beautiful verse from the Psalms. And this is from the Message translation of the Bible, which is my favorite. But I think this is very pertinent to us talking about the environment. This verse says, God's glory is on tour in the skies, Godcraft on exhibit across the horizon. Madam Day holds classes every morning. Professor Knight lectures each evening. I just got back yesterday from a short trip with my husband to Yosemite, which is one of my favorite places on the planet. And we did just the most glorious hike with incredible epic views the entire day. And so this really speaks to me right now that God speaks to us through his creation, and we can learn so much from the nature and beauty around us. And also this verse is calling us to then take care of that beauty and that nature around us and pay attention to how we interact with nature and how our health is then affected. This is a brief, very simple definition of what is environmental health. We want to make sure that we are free from illness or injury that would happen because of either being exposed to toxic agents or general environmental conditions that we live in that are detrimental to human health. This model is often used when speaking of environmental health. It's the ecological model of public health. And it is just a kind of another way to visualize what we've been talking about all semester, where health goes far beyond our genetic and our biological factors, but it really needs to take into consideration our social networks, our community, our living and working conditions. If you remember that TED Talk that we watched at the very beginning of the semester on how our living and working conditions really are what make up our health. And then our environmental conditions are a piece of that. And there's examples here. So always come back to Healthy People 2020, which hopefully very soon will be Healthy People 2030. It's been on hold because of the pandemic finalizing their objectives. These are just a few of the many environmental objectives. You can see the EH and then the numbers. So I've just picked out a few that I think are important to note. We will talk about blood lead levels in children, and then lead-based paint in homes is one that I put on there. Also, there's things about allergen levels, about reducing the amount of toxic pollutants in our environment, and pesticide exposures that end up with people going to seeking healthcare. Just have this slide here for you to, I really like making connections. Public health can sometimes feel a little bit disjointed with all the different broad topics that we cover, but really they all speak to the same thing. Lillian Wald, if you remember, the mother or the founder of public health nursing, she was huge on improving the environment. She was the one who took kids on field trips to the countryside when they'd never been out of their urban setting. She was the one who created the first playground for children with disabilities. So she was big on improving environmental conditions that would affect health. I just mentioned this TED Talk video where it was a woman with indoor allergens who just kept seeking healthcare because she wasn't getting the treatment. No one was asking the questions to even discover that she had indoor allergens. And so if you remember, health begins where we live and work and play. Social determinants of health, obviously, that's what we're all talking about. We haven't talked about genetics this semester, but I think it's really important to highlight this. There's actually not only a human genome project where we've mapped all the genes in our DNA, but there's also an environmental genome project currently going on. And so far, they've discovered about 400 environmentally responsive genes. This is the idea that based on our environmental conditions, that can affect the way our genes are turned on and off, and then can have major consequences. And so this is along the lines of this field of inquiry called epigenetics, where we are learning that either by our relationships with others, the air we breathe, the food we eat, things in our environment actually affect our genetics, which is just mind-boggling to me. So fascinating. This definitely applies to epidemiology, and we've talked about surveillance. So looking at keeping an eye on monitoring diseases. Well, the link here takes you to the California Department of Public Health, where they have an ongoing childhood-led registry. So it is mandated in our state that whenever a child enters any sort of state certified preschool, daycare, or kindergarten, that they have their blood lead levels checked. This is a huge concern for children and health. And then if you click on the link, it's really fun to click on the link about geographic information systems. It takes you to a really cool article out of USC, where they have been looking at things like mapping certain kinds of cancer, and then finding correlations that the people who had those certain types of cancer lived just upwind from where there was a lot of crop spraying, so a lot of pesticide exposure. So this is definitely pertinent to my own life. My father has been a fruit grower my whole life, grapes and peaches, and he is now has experienced non-Hodgkin's lymphoma 3 times. He's doing great now. But there is a strong link to non-Hodgkin's lymphoma and pesticide exposure, specifically from pesticides made by the company Monsanto, who also makes Roundup. And so I don't know if you've heard about this, there's an ongoing major class action lawsuit, and my dad is a part of that because there's so many scientific links there. I'm not going to read this to you, but I have this for your reference, and I also have a CDC fact sheet. I want you to be very familiar with this if you're not already, but blood lead levels in children is considered to be the most significant environmental health risk in children. So there's reporting that is required, and I've kind of mentioned that already. It talks about concerning blood levels. What do we do? Best strategy is prevention, and the fact sheet offers more of that. Again, this topic could go on and on forever and ever and ever. So I'm just going to highlight very basic concerns related to environmental health. Some are related to air, the air that we breathe. We know that different types of air pollution can cause all sorts of lung issues. AQI, if you're not familiar with it, stands for the Air Quality Index. It's a way to measure air quality. It's developed by the EPA, Environmental Protection Agency, and it actually shows up on your phone now. If you scroll up, at least on my iPhone, if I scroll up on the weather app, I can see the AQI for that area. And for me, I have pretty severe seasonal allergies, which really are year-round allergies. It's really helpful for me to know when I'm going to another place what kind of air quality I'm walking into. This link here, please do this. This is really fun and interesting, but basically it's an environmental tracking tool set up by the CDC. You type in your zip code or your city, and it tells you about all the different environmental health data from where you live. So how many people spoke, what's the air quality like, how many schools are too close to freeways, that sort of thing. It's really interesting. And then if you click on this bottom link here, the National Library of Medicine's website called ToxTown, it's also a really fun resource. It's actually for, not necessarily for healthcare providers, although it's very informative for us, but it's for lay people to be able to explore all of the different toxins that are in any given region, what kind of diseases can happen, what your risks are, what you can do about it for prevention. It's a really, really helpful tool to share with others. Water is another huge issue of environmental concern. It has been named as the biggest global health issue. So worldwide, the scarcity of safe drinking water. Lots of horrible things are found in our water, even here in the United States, unfortunately. And then food is another issue. Obviously, there are lots of harmful things when we use pesticides, when hormones are injected into animals that we then eat. Food additives, that's a link there to learning more about the effects of food additives on our health. And that's from the Environmental Working Group, which is the TED Talk. It's not really a TED Talk, but TED Talk-like talk that you are watching this week by the president of the Environmental Working Group. They are our leading organization nationally for advocacy and research related to environmental health. I use them even for things like what's the safest sunscreen to use for myself and my kids. And so really lots of great resources, and this is their piece on food additives. Obviously, we know that improper food handling can cause microbial outbreaks. You might remember the E. coli outbreak in romaine lettuce not that long ago, maybe 2 years ago. And then when we think about food and the environment, we can think about all these things that I've mentioned that are individual effects, but we can also look at the broader effect on the earth in general. So the next few slides kind of cover that. Um, this slide here shows the water footprint of different kinds of proteins, meat proteins and plant proteins. And you can really see that the certain types of meat really take up a lot of water to produce, essentially. And so this is really important to consider when we sometimes have a water scarcity issue. And then this is the carbon footprint. So this is the amount of emissions that are produced by growing and processing these types of foods. And meats are definitely the worst for this. And this may not be new to you, but I think it's really helpful to see this in a graph form. It helps me kind of rethink the way that I want to eat. If you haven't already, this is the link there, but it's also linked in Canvas. Make sure you watch this wonderful talk on the 10 Americans. And it's a little bit old, but it's very relevant and insightful. One thing that I just want you to be aware of is not only the Kids Safe Act that he talks about at the end. I'd love for you to learn about where that act is now. There has been some movement, but also just make sure that you are aware of when he talks about the precautionary principle. That's also in our ANA reading for the week, but I want you to be familiar with what the precautionary principle means and how we would advocate to apply that to policy. I won't read this because this is also a fact sheet that I've linked for you, but it's basically kind of a cheat sheet for how you would interview someone about their past environmental exposures in order to get a better handle on their health if you think that environment may be involved. So sample questions here, and it's a mnemonic I prepare that can help you kind of remember the different categories to ask about. And then last, we want to talk about, well, what is our role? Obviously, we are a part of assessment, but we can also get involved in a policy and advocacy way. We can organize public forums. We can bring up questions about how close is this new elementary school to the freeway? And are those kids going to be breathing in unnecessary toxins from that? There are so many different areas that we can ask about related to our environment. And we can do these risk assessments, whether it's on an individual level with iPrepare, or we can look at the surveillance data, the geographic information system, which is basically where they map that surveillance data and look for clusters of cases of different things. That can be really helpful. We can do investigations, like I mentioned already, with the USC study and with the case of my dad and Monsanto and non-Hodgkin's lymphoma. And then we can work to develop policies. And this might be something that you would consider looking up for your own agency, wherever you work now. Healthcare Without Harm, I'd love for you to click on that link and just explore. This is an international advocacy organization that is dedicated to healthcare being provided without additional harm from chemicals that are used, such as cleaning supplies or medical supplies that have toxic effects. And so just one small example, and I have kind of listed here how to go about finding it, is that a pledge that many hospitals and healthcare facilities have taken around our country and around the world is, how can we reduce mercury, which we know is a neurotoxin? How can we reduce that in the hospitals? If you kind of go down the rabbit hole here, you'll find that there is a huge list of so many different medical supplies that we use on a regular basis that could contain mercury. And so it's just interesting to think about that as we're trying to help people, we're actually also introducing them to things that could be hurting their health over the long run. So I encourage you to check that link. You will be doing an application assignment this week where you get to explore an environmental topic of interest to you. And so I'm just kind of throwing out all these different exposure to different things that you might want to dig deeper into. I'll end this by a lovely quote from Chief Seattle, who says, "Whatever befalls the earth befalls the sons of the earth. Man did not weave the web of life, he is merely a strand in it." So it is our calling, it is our duty to make not only our health better, but to make the earth's health better for our sons and daughters.